Welcome, everybody. Welcome. Okay, we'll go ahead and get started. My name is Mindy Mitchell. I'm a Senior Technical Assistant Specialist here at the National Alliance to End Homelessness. Just a few quick housekeeping tips. All of you are muted, but you can chat and enter questions in the Q&A. Our colleagues, Mia Bryant are here, and Kay Mosher McDivitt are here to both present and help out on the webinar. Kay will be in the chat and monitoring the Q&A. You can ask your questions in the Q&A. We're going to hold all questions till the end. The webinar is being recorded, and the slides and the video of the webinar will be available to all registrants within 24 hours of the webinar. Again, this webinar is about emergency rental assistance, ERA, that you guys have heard about, which is a different funding stream from maybe what we've been talking about in these webinars on homelessness assistance. While it's not targeted specifically to the homelessness system, many of the pandemic-related federal funding resources can help improve your community's response to homelessness. So with the ERA program, it can be a potential powerful resource for homelessness diversion, which is what we're going to talk about today. We're going to do a little overview of ERA, about diversion, and the role the homelessness system can and should play. So just really quickly to touch base again, for those of you who have been on all of the webinars previously, we have a really historic opportunity with all of these fundings. If we maximize them, we can make a real impact on homelessness. Tens of thousands of people can be housed with this funding. For the first time in many of our communities, we can achieve a significant reduction in our homelessness populations. But to do that, we want to start with a set of values that guide the strategic use of all these funds, whether they're homelessness related or not, or tangentially related like ERA, which we're talking about today. First of all, you should use these funds to the maximum extent possible to reduce the number of people currently experiencing literal homelessness. As we've talked about before, you should be using these funds to serve people with the highest needs because they are most in need, but also because these are the folks who remain homeless the longest, and that impacts both flow into the homelessness system and creates more unsheltered homelessness. You also should be using these funds to reduce racial disproportionality and disparities, because the homelessness system can reduce disparities caused by other systems and can continue to perpetuate them. So your communities have the potential to use your data in a way that furthers racial equity, and applying that information and analysis to the use of even these ERA funds is a really concrete way to further that value. And April from Montgomery County, PA, is going to talk a little bit about how they use the data to ensure equity in the diversion work that they're doing. Again, all of these funding streams, maximizing them requires creating and strengthening partnerships. Those are key to successful implementation of all of these funding streams. It's critical that you value these partnerships from the get-go, and that their structure is further developed to ensure better implementation further down the road, and hopefully institutionalize some of these partnerships even beyond the pandemic. And of course, you need to act with urgency. These funds are for emergencies, and Congress wants to see them spent quickly. They should be spent quickly. People are literally dying on the streets and suffering in shelters, and they need help now, and that help is available. Kay is going to be sharing in the chat some links throughout the webinar, and she'll be putting one in that kind of lists a little bit more information about these kind of core values to think about as you're maximizing this federal funding. So really quickly, I do not claim to be an expert on emergency rental assistance, so I'm just going to go through really quickly some of the information from the Treasury, which is the department that this particular funding stream is coming from. Kay is going to share a link in the chat to a lot more further information that we're pulling this stuff from. The Department of Treasury also developed some new frequently asked questions, FAQs, so their grantees can have some assistance with implementation, and we're using a lot of the information that you're going to see on the slides here from that, the link that Kay is sharing. So again, this program, this Emergency Rental Assistance ERA or ERAP program, can be used for families experiencing homelessness to help them gain access to assistance. Even for vulnerable families that don't have a current rental obligation, there's a commitment letter process to help those families gain access to assistance. It can help families who have lost or at imminent risk of losing housing, can pay for relocation assistance, prospective rent, security deposits, also temporary hotel accommodations, which is an important thing to think about for diversion too. The Treasury has clarified that there should be equal access to these resources and that communities should be removing language and cultural barriers to ensure that everyone is able to access this assistance. So that fits right in with our values about centering equity in this work. Kay's also going to share a link to the frequently asked questions. This is an important one from that about who is eligible to receive this assistance. And you'll see here that they must be obligated to pay rent on a residential dwelling, and that the loss of housing or the hardship has to be due directly or indirectly to the pandemic. And you have to demonstrate a risk of experiencing homelessness or housing instability. And of course, there's the income requirement. And again, it's all about removing barriers to getting this assistance. So Treasury has strongly encouraged that people are allowed to self-certify on these eligibility requirements. Determining whether someone is at risk of experiencing homelessness or housing instability. These are some of the examples of documentation. And finally, this is further clarification about using some of these funds to provide temporarily displaced households to pay for hotels and motels. Again, all of this information is available on the links that Kay is sharing. We just wanted to give you a brief overview. This is absolutely a funding stream that can and should be accessed by people experiencing or at risk of homelessness. And it's a really, really great resource to use for diversion. And now my colleague, Mia Bryant, is going to talk about diversion and what we mean when we say diversion and a little bit more about how ERA should fit into that. Go ahead, Mia.
Thank you for that, Mindy, and hello to everyone. Thank you for joining us today. As Mindy was saying, the ERA funds, or ERAP, as you may have been hearing it referred to, can be used to prevent and end homelessness and can be done through the practice of diversion. Diversion is an intervention that is designed to address the immediate needs of someone who has lost their housing, may have become homeless, and are seeking shelter. And it helps by assisting them with identifying safe alternatives to shelter, so safe permanent housing alternatives, rather than them entering shelter or experiencing any type of unsheltered homelessness. Next slide. So to do that, diversion requires there to be a coordinated entry process. Diversion should happen when someone is seeking shelter. So there needs to be a front door. There needs to be an access point where you're capturing folks and having these problem-solving conversations. To have these problem-solving conversations, staff must be trained in doing some mediation, conflict resolution, strength-based assessment, helping folks to identify their strengths, acknowledge that there are strengths that they have, and that they're able to problem solve their situation. Problem solving, of course, is that is the whole conversation. So being trained in problem solving can help you to facilitate that process. Motivational interviewing, so that you can find out that information that is pertinent to that person's situation, and also trauma-informed care, as well as racialized trauma-informed care, to ensure that folks feel safe, they have options of choice, and their trauma is addressed, acknowledged, and they're connected to resources. Speaking of resources, those linkages to services, natural supports are essential. So being connected within the community, understanding what is available in your community, what eligibility is, and what might be appropriate for the folks that you're serving. And then flexible funds are always very helpful for folks when you're helping them to resolve their crisis. But this goes without saying that money is not always required. Sometimes that problem solving, that mediation can resolve a person's crisis and divert them from homelessness or from shelter without any funds being used at all. Next slide. So you want to ensure that as we're talking about the ERA, the Emergency Rental Assistance Program, or ERAP, that you're adding that to your toolkit. You guys are already doing diversion, implementing diversion in your systems. So now adding ERA as an additional resource can help to assist folks who are facing a housing crisis due to the COVID crisis. So adding that to your toolbox as a potential possibility. With that, you must understand how to access ERA, integrate ERA as a resource into your housing plan. So you're still developing those housing plans with folks, but this is an additional outcome, an additional resource that you can help get folks connected to if it's appropriate. And with that, making sure that you're creating those warm handoffs so that folks can access the resources and effectively use them to resolve their crisis and end or prevent their homelessness. Next slide. Some of those outcomes. So again, you're you may have to click again, Mindy. Sorry, 3 more times. So some of those outcomes that we're talking about. So as you're developing these housing plans, ERAP may be included in while that person is utilizing or getting connected to that service. You can help them with potentially going back to stay with family or friends, returning to their own residence if it's appropriate, if they still have access and are able to return to their residence while they're seeking the rental assistance resource. They could be temporarily diverted to a friend or family member, or another option as they're seeking new housing. Or sometimes they may need to go to out of town. Maybe they have a friend or family they can stay with, someone in their social network that can house them or help to at least permanently or temporarily house them as they are working on their permanent plan, which may include the rental assistance that we're talking about today. Next slide. But with that, you want to ensure that you can effectively include the rental assistance resource in your housing plan. So a to-do list for you all, and this is not completely inclusive. There are other things that you might need to do, but we encourage you all to know who has the funding, who are the grantees of this funding, what are the current requirements? Are there requirements that are through the Treasury, that are through this particular funding? But are there also requirements through the grantee, through the programs and the organizations that hold the funding? Ensure that you are aware of those. Build partnerships and relationships with those providers to understand what the requirements are, to know who is the contact person, any advocates that can assist. There may be certain standards, and you want to ensure that the folks you are working with, are eligible and meet those standards. And again, create those warm handoffs for those who you are coming into contact with, that you're having these diversion conversations with. Make sure that they're connected to the ERA providers, not just by saying, hey, call this number, but some folks may need that additional assistance of you sitting down with them, of you calling with them or for them, or going to that meeting, whatever that may consist of. You want to ensure that you're supporting people in households in the way that they need to be supported so that they can access that and take advantage of that resource. So assist them with accessing the resources, and sometimes they may need help with paperwork so they can meet those eligibility requirements. So you want to ensure that you are, really in support in a well-rounded way so that folks can utilize that resource. And again, this is as part of the diversion work, the problem-solving conversations, the housing plans that you are already doing and you are already creating. So that was my little tidbit, and I'll hand it back off to Mindy.
Thanks, Mia. Great overview of diversion. And I've seen a couple of questions about very specific stuff about ERA. Again, I am not an expert on emergency rental assistance, so I definitely want everyone to check out the links that we've been posting for the frequently asked questions and the fact sheets about eligible activities for emergency rental assistance. And also on diversion, someone answered a question about, do you have to be in shelter to receive assistance? Absolutely not. ERA itself is actually not specifically for people experiencing homelessness. It's for anyone who is at risk of losing their housing or has lost their housing as a result of coronavirus related problems. So that includes homeless folks, but it also includes a lot more people. That's not specific to just people living in shelters. And for diversion activities themselves, like Mia talked about, diversion is about keeping people out of shelter altogether. So absolutely not for diversion activities. It's not that folks have to be in shelter. We're actually trying to keep folks from coming into shelter so that they can skip getting caught up in the homelessness system altogether. And yeah, Kay, if you will, please keep sharing in the chat. I know you guys, the chat is kind of scrolling really quickly. So Kay's going to keep sharing links so you don't have to keep trying to scroll up to find the links. And we'll go ahead and get started now. So this has all just been an overview of very briefly ERA and of diversion. And now the really important thing that we wanted you guys to hear today is about a community that's really putting this stuff into practice and doing it through a racial equity lens and really focusing on outcomes and ending homelessness. So we're really happy to have April McNeal from the Montgomery County, PA Department of Health and Human Services, the Office of Housing and Community Development. April, go ahead. And just let me know when you want me to advance the slides.
Absolutely. Thank you so much, Mindy. And I just want to get started that everything that Mia stated, I will be going a little further into depth with today. But first, again, thank you everyone for joining this session, talking about a very important matter that is going on across our country. My name is April McNeal. I work for the Montgomery County, but we work for Your Way Home, which is a public-private partnership whose mission is to ensure that everyone who lives, works, learns, and invests in Montgomery County has an equal opportunity to live in an affordable home in a thriving community. In January of 2014, Your Way Home was established as the county's unified and coordinated housing crisis response system for families and individuals experiencing homelessness or at imminent risk of homelessness. Your Way Home's mission is to ensure that everyone who lives, works, and invests in Montgomery County has the equal opportunity. Your Way's Home's official launch was in 2014, and anyone who was experiencing homelessness or on the brink of homelessness had to navigate a very disjointed system. The help they did or did not receive depended on who they knew. The luck of calling the right person, knowing the right person, being at the right place or the right time, having to sit on a first come, first served waiting list for many years. Montgomery County knew that they needed to make changes because this was not serving those who really were most vulnerable. Next slide. So what was created was a Your Way Home homeless crisis response system. Your Way Home embraces a housing first approach to ending homelessness by first helping people who are experiencing literally homelessness find or maintain permanent housing with stability and connecting them with the community, health, human, and financial services they need to prevent future experiences of homelessness. Through coordinated entry and assessment, Your Way Home prioritizes housing and services based on vulnerability and need rather than that first come, first served process. Through progressive engagement, consumers are given just as much services and support they need to succeed in order to preserve costly interventions like permanent, supportive, or subsidized housing for families and individuals with significant and lasting barriers to housing stability. The major components of Your Way Home include coordinated entry through the Your Way Home 211 call center and street outreach team. Coordinated triage and assessment using the service prioritize and decision assistance tool, which is often known in this world as the SPDAT. A community queue to prioritize households for housing and services based on vulnerability and the severity of need. Housing-focused emergency shelter services, which includes centralized shelter bed management, diversion services that Mia talked about, which helps people find alternative, safe, and appropriate housing other than entering a shelter. The goal is to keep people out of the shelters. The goal is to reroute families, so that reroute families and individuals to other places until they can find somewhere safe to go to rest their head, as we provide them with resources and case management moving forward. This housing resource centers are staffed by housing stability coaches and housing locators to rapidly rehouse people who are literally homeless. Transitional housing for select populations include transitional aged youth, people fleeing abuse and violence at home, and people in early stages of substance abuse recovery. Permanent supportive housing for people with significant barriers to permanent housing stability and connections to mainstream and community services, which could include childcare, food security, physical, mental, and behavioral health, employment and job training, public benefits access, and veteran services, amongst others. Next slide. So the Your Way Home Emergency Rent and Utility Coalition. The Your Way Home Rent and Utility Coalition, and to be clear, we at Montgomery County, and which I'll go into further soon, we call it the ERIC program, as you can see, for Emergency Rent and Utility Coalition, and there's a good reason for that. It is what we call ERIC is an initiative of Your Way Home that launched prior to the pandemic, because we knew this was something that was already a need for. The coalition's purpose was to raise public and policymaker awareness of the needs of low-income and what we refer to as ALICE, asset-limited, income-constrained employed families and individuals in Montgomery County who are on the brink of homelessness due to poverty caused by a health crisis, job loss, pay inequality, and others, such as systematic racism. This coalition also advocated for more public and private funding for emergency rent and utility programs. This was when it was first created, it was not an actual program. This was a group of community members in Montgomery County who had little pockets of money and would support families or individuals here and there. Next slide, please. So as we know, the pandemic came about, and we received, amongst everyone across the country, an influx of funding we were not expecting, but it presented an amazing opportunity. Over 10,000 households contacted Your Way Home Coordinated Entry 211 each year seeking assistance with their rent. But typically, there's no money available, as many of you know, for rental assistance. The pandemic put an extreme highlight that this resource was needed, because when you ask for people to stay in their homes, but not everyone has a stable home to stay in, the need for targeted emergency rent programs becomes apparent. Therefore, with the money that Your Way Home Montgomery County received, we were able to turn the coalition into a program, which again, we labeled ERIC. Montgomery County has received both direct allocations from the Treasury due to our size and population of the county, as well as additional funds via the state. We have received 64 million so far and expecting another 40 million. The coalition, which was comprised again of diverse members of our community, and allowed us to bring partners to the table and frame equity as a core component from the beginning of the original concept. We also built the program around our existing homeless crisis response system infrastructure, committing to the use of HMIS and coordinated entry. Next slide. As Your Way Home moves into its 8th year of implementation, we are embracing new strategic framework that expands our work to include addressing the crisis of affordable housing, homelessness prevention, and equity. Over the years, Your Way Home has created and adopted core strategies known to be effective in ending homelessness, adopting a housing-first approach, coordinated entry, and rapid rehousing, amongst others. We were able to put these values into action with ERIC. Partnered with Your Way Home agencies primarily led by and serving people of color. Utilize the Urban Institute Equity Tool, we targeted specific zip codes for prioritization. We embraced the use of the HMIS to track data and outcomes by gender, race, ethnicity, income, and more. Utilize the existing infrastructure of community-based organizations, coordinated entry, and a public-private partnership. We utilize a hybrid coordinated entry approach. Applicants can access the program via the phone, online, or in person. We stayed away from third-party software organizations because it did not meet the needs of households most at risk of homelessness. Next slide. So again, instead of using the new software for the application, we expanded our homeless crisis response system in order to better triage and prioritize ERIC assistance for the most in need, including those experiencing and at risk of homelessness. We expanded our contract with 211 to get more call center operators, including bilingual operators who pre-screen for basic ERIC eligibility, then refer to an ERIC nonprofit. Call center and ERIC nonprofits enter household information into the HMIS system with household consent, and this is how we help to avoid duplication of benefits with other federally funded programs. This also allows us to help households contacting coordinated entry in multiple ways. A person could be referred to homeless services as well as to ERIC assistance. So as long as they qualify, of course. A person's needs are diverse. So we have coordinated entry help refer to as many local programs and resources in the community, such as food, showers, mail, LIHEAP. A big thing that we've seen is that people, as this pandemic has gone on, people do not have up-to-date ID. The new child tax credit and financial services as well. Also, by utilizing coordinated entry in HMIS, all housing and homeless service providers are able to coordinate amongst themselves, particularly for households working with multiple nonprofits. That way we are not siloed. We work together as a team. Next slide. So our ERIC program is not, again, not a first come, first serve. There continues to be more need than we have money available. It sounds like a lot of money, but when folks have been when folks have been already low income, close to homelessness before the pandemic, it is not enough money to basically solve poverty. There continues to be more need than those resources. We are committed to helping the most vulnerable first, including people experiencing or at imminent risk of homelessness, such as they've received an actual eviction notice. They're receiving utility shutoffs. Thus, our prioritization policy states that the ERIC nonprofits work with households who are at 30% AMI, still unemployed, and to target those specific zip codes that I talked about previously. And those zip codes, higher shares of households are living in poverty, cost burden, and low income renters, severely overcrowded houses, or unemployed. We receive this information from the Urban Institute tool. And I believe Mia has shared that tool. It's a very great tool and I suggest everyone to take a look at it. Eligible ERIC households are pre-screened for these priorities, added into HMIS and sent to a waiting queue. Yes, there is a waiting list because, again, as I said, the COVID-19 pandemic only brought to light how many people did not really have homes. There's going to be a waiting list no matter where you are. The nonprofits then pick up households that are the priority, serving them first, such as they have nowhere to go. They've been locked out, even if there's an eviction, federal guidelines where you can't do so. People were still being locked out. Renters ended up on the street. They have an eviction notice. Any of those, weird situations in which some of our families have been placed into, we are trying to support those families first. Next slide. So we heard a little bit about the ERIC and diversion. Our ERIC program is, again, I want to repeat one more time, it is not first come, first serve. We're committed to helping those who are most in need. Our prioritization is just much important. ERIC has shown to be successful in our diversion efforts as we prioritize at-risk households and serve people in many vulnerable situations, such as living in hotel or motels, couch surfing, or they're typically contacting Your Way Home 211 in emergency housing situations. While we don't know the data yet of how successful ERIC has been in diverting households from having to utilize shelters or rapid rehousing or other core homeless programs, we will eventually be able to analyze this because we enter it through the HMIS system. We are seeing that homeless providers and ERIC providers are working together. Next slide, oh, sorry. In 2018, Your Way Home launched the Eviction Prevention and Intervention Coalition, which we call here in Montgomery County EPIC. Initially, a pilot project designed to stabilize vulnerable families and individuals in Montgomery County who are facing eviction by providing them with free legal and social services, support on site on the day of their eviction hearing. Additionally, the program provides financial assistance right at the court to prevent evictions in play and connect them to long-term financial and social supports needed to prevent housing instability. Because we have EPIC, we had existing relationships with our courts, our local judges and their clerks. Additionally, the EPIC social service provider, who is also a nonprofit that we work with, also became an ERIC provider. This essentially allowed ERIC to target people facing eviction in the court as we all know that evictions still happen despite the moratorium. We partner with our local legal aid organization to provide legal support and services to enact the moratorium as needed and provide pro bono legal representation for the court hearing. Currently, EPIC and ERIC are available in 7 of our county's district courts, and those 7 courts see the highest number of evictions every year. Next slide. So as of 8/12, a few days ago, we have served 8,497 households. As you can see, the highest number of households by demographics is African Americans, with white next, and then on and on. A lot of families, a lot of individuals are at risk. 15% identify as Hispanic or Latino. 67% are female head of household with children. 7% with domestic violence history. When we think about these numbers during the course of almost 2 years now, there is a lot of families at risk of homelessness. And now, if you see the 67%, a lot of children as well, as we're going back into the school year. So this program is really important. We need to work with our local nonprofit agencies who are doing the work on the ground already to making sure that we allow this money to access the most in need. Next slide. Next slide. Okay. So this is the end of my presentation. There's so much more that I could have covered in a short amount of time, but please don't hesitate to visit our yourwayhome.org website. You can reach out to us on Facebook, Twitter, and you can also reach out to me via email. My phone number and email is on this slide, as well as on a couple of slides as well. And at the end of this session, then we can answer any questions that you may have for us. Thank you so much.
Thank you so much, April. This was so inspiring. And you can see the chat was blowing up as you were talking. Love Montgomery County PA's acronym game is tight. You guys have some great stuff going on there. So you guys, we are going to have a special guest from the CDC who is actually not with us yet. I will go back to those slides in her part of the presentation. What we'll do now until our CDC person gets here, we'll go ahead and do the Q&A about diversion, ERA, and especially lots of questions about what's happening in Montgomery County, PA. So April, Mia, Kay, also, if you want to join us, let's get started. So April, lots of questions about the Urban Institute, racial equity, spatial equity tool, and some questions about whether Montgomery County, PA is still using the BI SPDAT or other tools that you're using to assess vulnerability. So tell us a little bit more about I know a little bit from working with you guys previously about the process with all of that, about doing assessments and prioritization and tools, but if you could just talk folks through kind of like that whole part of it again, because you guys did a lot of really thoughtful work, and I think it's really good for other communities to hear about that.
Sure. So there was a lot of questions within that statement. So I'll just back up just a little bit and basically
just tell me whatever you want to tell me.
We use the Urban Institute, and I wish I could actually show you. And it shows you you can put in the zip codes for your county, and you can see where the highest pocket, and actually on a few slides back, I didn't even get to that part. But if you look back, there were certain parts in darker color, and that was specifically from the couple of more slides back. It was kind of in the beginning. Oh, if I'd have known it. Okay,
Oh, there we
right
go.
here. Okay. So these are some of the highest hit areas in which, and I want to put it out there, Montgomery County, those who live in Pennsylvania know Montgomery County is one of the richest counties in Pennsylvania. I say that to say there are a lot of people who are low income. Many are unaware due to whatever privileges they may have, that these folks live right next door to them, right in their backyards. You know, so Pottstown is a huge area in which it's what they call a suburban urban area. Not a fan of the title. But it's as well as Norristown, even inside of Lanesdale. But also in between those areas, it's a lot of rural area. There are a lot of African Americans, Hispanic families, immigrant families that live in these townships within the Pottstown, Norristown area. And there are some few others. Also, because again, we're talking about Pennsylvania, so people typically know about Philadelphia or like Pittsburgh. So those are your options. We are right outside of Philadelphia. So again, we border Philadelphia on several different areas. You can get to Philadelphia in 2 minutes. You could cross the street and be into Philadelphia. So we're very close to like the urban, and I hate that term as well, but the urban community. So we use the Urban Institute to find out in Montgomery County what are the highest areas in which there are low income families or low income individuals. And so that's how we use that to find the folks that we have. Also, the continuum care. So the 6 nonprofits that we work with are directly based into those communities. So these are people who already know the folks that are in that neighborhood. These are not people that they're calling up on a phone or you're giving all your information to over a phone and you're like, who is this person? These are people who work in the community. They already have other programs within that community. So I'm hoping that answers your questions. That's how we get to it. That's how we prioritize folks first. And also if they call, when they call 211, or if they stop into our office, they still have to meet at least at the 50% AMI, and we prefer to work with those at the 30% AMI, or an eviction, or a shut-off notice, or they received a lockout. That is who we're focused on. So you can't just call and say, I'm behind on rent, you know, I need help. We will eventually get to that person. So that time frame may look like for one person, 1 to 3 weeks. For someone else, it might be 3 to 6 weeks or 3 to 8 weeks.
Awesome, thank you. And April, the specific question about the VI SPDAT.
Yes. So it is basically a system in which we already use with our homeless, so I work on the prevention side to hopefully prevent folks. Then we work on the other side. So it is a system, again, in which all that information is put in and it turns into data, and we use that data to evaluate. And typically before the prevention side, which has just started as an official program some months ago, the homeless side, who were more of a crisis, they were using that data to show who were most in vulnerable in need. And if you go onto the Urban Institute, you can find out that the numbers and data for your area of who you should be targeting.
Great, thank you.
Mindy, there's a question here, and they're asking, April, this would be for you. If there is a landlord that's more respectful of the moratorium, right? And they just give a ledger to show past due, but the participant meets other prioritization, will they still get prioritized? I think you were I think, April, you were talking before about like not everybody was respecting the moratorium, and folks, were becoming homeless, or having to leave. But will people still get prioritized, if they are still in their housing, if they meet your other prioritization standards?
Yeah, so the goal is everyone will get service. That's the goal. But those who, again, have the landlord who doesn't sound like they really want to participate, if they do not want to participate, there is different steps that we go through, such as the case manager will contact the landlord 3, 4, maybe 5 different times to try to, say, hey, this is a great idea, this is why it's beneficial, explain what the program is, because if we just go about what we hear on social media or in the news, people's idea may be a little shifted. But if you are hearing it from the expert of what this program means and that you're going to get your check, most landlords are participating. Some landlords who already probably want that tenant out won't participate. And if that's the case, we will work directly with the individual and provide the check to them. Now, we do ask for receipts to say, hey, especially if they plan on coming back for additional funding, have those receipts on hand, take pictures, things of that nature, so that if you feel like you needed to come back for 3 months further of support, you can do so. So in most cases, as of right now, I have not seen where that's not true. I've only seen it once where that was an issue, once literally this week. For the most part, it is going very smoothly. Most people want to stay in their homes. Most people are paying who they need to pay so that they can stay where they need to be.
So, April, I'm going to throw a question out here that is not
Sure.
something that you actually talked about today, but you talked about it to a degree, but not as much as maybe we chatted about it before. But one of the things that you did to make sure, like, to use that lens of racial equity, is that you, instead of partnering with traditional partners to disperse the funds, you actually worked with community-based organizations that had not historically provided prevention assistance or worked with federal funds. You want to just talk a little bit about like the role that you have, the kinds of support that you are giving to those new community providers to make sure that you are really getting folks in the community connected to the local providers?
Sure. So I host bi-weekly meetings. They have access to me during my working hours, but they have access to me on a regular basis. We're also in the works of providing them with trauma-informed training, implicit bias training, so that you're providing the best effort that you can. So we're providing them with the support on the ground. They're already on the ground, and we're providing them from a different perspective to be from a more strength-based mindset. Because I'm sure we've all heard out here like, oh, who should get the money and who shouldn't get the money. The money we're going by data here. And the data shows this, and those folks are going to be prioritized first. So that's what we're doing to support those nonprofits. And not only are the program managers or directors in this meeting, but also the case managers. Oftentimes, when you have the meetings with different community members, it's with the executive director, the director, and things of that nature, in which it doesn't actually reach the people who are working with the folks. So I talk to them on a bi-weekly manner, and those case managers, although they have their own management system at their organization, also can contact me for further support and clarity, or I can, jump into support as well.
Thanks, April. We've had some questions. Mia, I'm gonna kick this to you, but I will say we've had some questions about all these different funding resources, how people are asking very specific questions about how do I connect to the grantee in my community. This webinar is not going to be that detailed, But we're going to share again a couple of links. There are so many federal resources out there now. April mentioned the child tax credit. There are a lot of resources that people who aren't literally homeless, but who are homeless or at risk of homeless, just really low income people. There are lots of resources out there now that we can get the folks we serve connected to without them ever coming into the homelessness system, which is what diversion is all about. So Kay, if you could find those links and share them again, all of these resources, y'all, are potential diversion resources and also resources for people who are already homeless, right? So that's an important part of diversion, is getting connected to all those resources. So Mia, do you want to just talk that again? Like, this is just good diversion practice, that partnering across the community. And then maybe April, you can kind of talk about like what that looked like on the ground, all the community partnerships y'all have created.
Yes, absolutely. Thank you for that question, Mindy. As we mentioned earlier, you guys are already doing diversion in your communities. And so ultimately, hopefully you all are connecting and understanding what resources are in your community. Before COVID, you might be looking at employment resources that are available, at, food resources, food insecurity resources that are available in your community. ERA is just another tool within your toolbox, a resource for you to understand, to get connected to the folks who are part of those programs, the grantees, and to really understand how to connect your folks to those programs. So it could look different in all of your communities. This could be, some folks may have an application process. They may have an application process for the funds and one to get in the program. It could look different in all of your communities. So we encourage you all to do some research on your own to find out what needs to happen, eligibility for folks to get connected, folks that you're serving to get connected to these resources, and take it a step further. So not just identify, documentation or eligibility, but put a face to a name, identify who might be a good point of contact, the office that handles that, who might you build a relationship with, so that you can ensure that there is a warm handoff. And when you have ongoing questions, ensure that you have, someone to ask them to. So that's what we were referring to when we were talking about application and things earlier. Get to know the resources in your community and create those warm handoffs for folks you are serving, because ultimately you are coming into contact with some of the most vulnerable folks in your community who have the highest need.
And
I'll hand it off to you, April.
You really want to build relationships, because you should be building relationships before this came about.
Right.
So if you're not, start today. There's a lot of people in here. Find out how they're building the relationships. Sign up for some more webinars. Work within the systems that's available for you, because when you have that warm handoff, people don't get lost in the system somehow. People don't really end up homeless, where they're not even able to, move from couch to couch anymore. If you're working with someone in the community, someone's going to know, hey, this person really has nowhere else to go. And I also want to say this funding can be used, although I try to explain it should not be the long-term solution. It should be a short-term solution, but these funds can be used for hotel, motel stay in the hope that the person is looking for an apartment or a room somewhere that's a little bit more permanent within their financial budget. So that way it's, long lasting. These are the little things. So a good case manager would be able to talk and explore with individuals on how to best use this money, because it sounds like a lot of money. It is, for people who like us, we don't have that money. But in the sense, when you have to spread it among so many people, it's nothing. It's a drop in the bucket. So we really need to explore with people on how to make this work in the best interest of them. Depending on your funding stream, you're only able to get about 15 or possibly 18 months of rent. That goes quickly if you already have an arrears of 6 months. So think about your own budgeting. And if you're behind 6 months and they only can tell you they can catch up with 6 more months, is staying in the hotel the best way you want to spend your allotment of money? No, it's not. You want to find some sort of nice low income apartment and rooms. And I know first-handedly that it is very hard right now to get apartments and rooms, but find somewhere who will be willing to work with you. And there are landlords who are, it's a little less these days, but work hard.
And don't forget about shared housing now.
Yeah.
You know,
Hello.
we acknowledge and understand that, especially because of the eviction crisis, because of, you know, the issues with eviction, that it may be difficult to identify, apartments for, empty units, available units, but there may be people who are currently in housing who folks can stay with and have their own lease, and use that funding for that. So we encourage you all to just get creative and to really utilize and optimize the resources and connections that the households you're working with already have, because that can allow you to maximize the funds, as April was saying, really utilize them in a way that can contribute to those long-term permanent solutions.
Thank you for bringing up shared housing. Oh my God, you guys, so much conversation about shared housing, and so many people seem to think that it shouldn't be an option for people experiencing homelessness. So I just put in the chat our recent blog on shared housing. It is how most of us live. Almost everybody on this webinar lives with another adult. It's how you make housing affordable, and that is part of
live with another adult.
Yeah. And that's a really important. So we have some more great questions, and we'll get to that, but we are super excited to have Emily Mosites from the CDC. Emily, welcome. I am going to go back through to the slides for you. Welcome, welcome, welcome. We're super excited to have the CDC. By the way, you guys, when we're talking about partnerships in the community, who's your local public health provider? Are you working with the CDC and whoever is representing your regional area to make sure that the people that we serve are able to access vaccinations and attend to their health in this pandemic? And so that is why we're super excited to have Emily on the call. Emily, let me breeze through these and get to your slides. All right, here we go. Welcome, Emily.
Hi, well, thanks so much. Let me just introduce myself really quickly. I'm sure I've talked to some of you all before, but I'm Emily Mosites. I am the lead for the section on the COVID-19 response at CDC that covers homelessness and also correctional facilities. But in my normal job, I'm the senior advisor on homelessness and health to the deputy director for infectious diseases at CDC. So wanted to connect with you all, and so grateful to be able to do so, to just give an update about what's going on right now. You are probably all aware that things are going on right now with COVID-19. So just wanted to give a little bit of context for that and answer any questions if you have them. So I'm not sure if I can change slides, but next slide. Okay, so I think probably everyone is aware that cases of COVID-19 have been increasing over the past month or so. We had this really lovely time where, in June, July, where we were talking about the end of COVID and it's over now and the pandemic is over, let's have parties. And then July happened and we started to see this surge of cases of Delta variant. This graph is showing us the cases of COVID-19 per week that occurred in the gray line. So that's, the weekly cases are on the left side and then dates across the bottom. The red line is forecasted cases for the next 4 weeks. So we were already in this very steep upward trend. The forecasts here, these are prediction models that are based on information that we know now about the cases that have been occurring. They are not looking very good at all. So it appears to, what we're seeing is a continued pretty steep upward trend towards what we were seeing last winter for cases of COVID-19. This is in the general population. So this is the expectation. This forecast is based on a whole bunch of different models all brought together to kind of come to this single estimate. It can be wrong. I hope it is wrong. I hope we can act in a way that helps us not see this over the next 4 weeks, but wanted to draw that to your attention. So if we go to the next slide, this is our county level information on COVID-19 on the county level. This is available on the CDC's COVID data tracker on the county view. This is incredibly important for a couple of different reasons. First, we can see that it's extremely red looking. That is representative of that high increase in cases that we've seen across the board. It started in the South, and now essentially the entire country is in high transmission of COVID-19. This is important because it shows us really that everywhere we need to have protections in place. This is also an important tool if you need to look up whether or not your particular county is covered by the CDC eviction moratorium. This is what it is based on. So it's a good bookmark to have if you need. So what I want to mention here is a couple things. We don't have data that is specific to homelessness for these case counts. But what we do know is that we are following up on a number of reported outbreaks in shelters. So we know that shelters are not immune to this rising cases. The outbreaks are occurring. It's going to be incredibly important to really do 3 major things. We want to make sure people are connected to vaccination. We want to make sure that testing is happening so that we don't miss it if an outbreak occurs. Delta is twice as transmissible as the original strain of COVID, which means that you need to catch it quicker. So it'll move really fast through a shelter if it gets in. So having regular testing is really important to make sure that you catch things before they get too widespread. So connecting with your health department or your healthcare partners that help with that testing is really important right now. And then finally, we had some discussions early on in that beautiful period in late June where things were looking good about how do we peel back some protection measures in shelters and for people experiencing homelessness. We are now not in that space to be talking about peeling back protection measures. We want to keep protection measures in place as much as possible. This is moving really, really quickly. The outbreaks are moving really quickly. So just want to make sure that awareness is out there. We are also available for any assistance as needed. We're also happy to help connect with health departments as needed. So our unit is on standby if you need help with anything. It is funny, I'm looking at this map right now. I'm looking at Nebraska. It's very blue, which looks great. It feels like we should all move to Nebraska, but I'm not totally certain if that is completely accurate. So happy to answer any questions, and thanks so much for letting me give an update.
Great, so glad you're here, Emily. And I think if we all move to Nebraska, the numbers would probably go up. It might be just, there's a lot of space out there. Also, by the way, shout out to Nebraska Balance of State COC, which is the second COC. The only other one is in Omaha, is one of the big Balance of State COCs that has ended veterans homelessness. So good work happening there. And maybe that's also what's going on with that big blue space there. Emily, while we have you on, we did have some questions for you specifically. Will people experiencing homelessness be prioritized for 3rd booster shots? I saw some stuff earlier today about the need for boosters. So can you tell us a little bit more about that and what's happening at the CDC specifically around that and people experiencing homelessness?
Yes, absolutely. So thanks so much for bringing that up. I meant to mention that. So yeah, we had this announcement this morning about booster doses. And the reason for that is because with Delta variant in other countries, we are seeing lower effectiveness of the vaccine, and we're getting out to a place where antibodies could be decreasing. So that's where the announcement for that booster dose came from. The logistics of that booster dose are not yet hammered out. So just as with the first dose, the Advisory Committee on Immunization Practices made the recommendations for doses, for age ranges, for prioritization, all those things. So they're going to need to meet about this and have a discussion about what that's going to look like. People experiencing homelessness, we know that there's a high risk of infection. We know that there's a higher risk of potentially severe outcomes because of underlying conditions. So absolutely, we certainly our unit will be considering the best ways to reach people experiencing homelessness with the third dose, but those logistics are not clear yet. So that information we hope will be coming soon.
Great, and we'll look forward to having you back on to let us all know about that when you guys have that. Another question for you, April and Mia, we'll be getting back to some questions about diversion and other practices, but while we have Emily have some specific CDC questions. And April and Mia, if you have specific CDC questions, please ask them. Another person asked, Emily, is the CDC going to be recommending any new protocols for shelters? I know, when the pandemic started, we moved to non-congregate shelters. And then again, there was that lovely little while where we were like, okay, we can move on. And now Delta. And so new protocols for shelters going to be coming out. What's going to happen with that?
Great question. So right now, as far as we know, the prevention measures that we know of are still the same prevention measures. This all happened pretty quickly, as you could see. This happened very quickly. So as we know right now, there are not any changes that are needed to the original prevention measures that need to be put into place. So it's about kind of putting them all back into place if anything was peeled back. We are going to be working on collecting data to see if there's any differences, if there is anything else that needs to be done. And we'll certainly let you know if there is any change to that. But the expectation now is to keep the same things in place.
Great. And related to this, Mia, great point in the chat that for all of us, if we're thinking about these federal resources strategically and diverting folks with the funds like ERA that we can use diverting folks, part of the function of diversion is keeping folks out of shelter, right? So good diversion practice also has a good public health benefit. You're decompressing shelter, and that helps folks who are experiencing homelessness. Great point, Mia. Again, and Mia said in the chat, this information from the CDC, this is why we wanted to have the CDC on today, is that we need to keep all of this in mind as we're thinking about rolling out these resources. These resources are COVID related. We're doing this through a COVID frame of mind, but these are all going to be really good public health practices going forward. Related to going forward, Emily, one more question for you. Are there any discussions happening at the CDC level about moving forward with the understanding that we'll never be able to completely eradicate the danger and risk of COVID-19? How do we move forward as a community when we're seeing the impact on health outcomes, both behaviorally and physically, as more dangerous than COVID itself?
That is a great too, and something that we think about a lot. Our unit has certainly dug into some information on the mental health and substance use outcomes of this pandemic. And there's a lot of tumult that has happened over the past year and a half. And, right when we get to the space where we think we're coming out of it, just turns around again. It's really hard to know what's going to happen. That's something that has been the case with this all along. It's just been so dynamic. It's been hard to pin down, hard to predict. Feels a little bit like a wildfire that just keeps, cropping back up again. So unfortunately, we don't quite have that crystal ball. Keeping the balances in mind is incredibly important. While also, of course, making sure that we're protecting people as much as we possibly can during this time, as especially right now, I would say the risk of COVID is very high and accelerating upward. So yeah, thanks for that.
Yeah. And one more, and this is related, I think you talked about this and we're still looking at the map of the high transmission areas. So talking about the extension of the eviction moratorium for high transmission areas, and just, it seems to me like effectively eviction moratorium is still happening in most of the country, and will probably continue because until we get a handle on Delta.
It's very hard to say because it is a complex legal matter.
Yeah.
But yes, it is tied to the levels of transmission based on this COVID tracker. So that's where you want to go to look for whether or not your county is covered. And otherwise, I would just say there's some FAQs that will be coming out from CDC that can answer other questions on that.
Great, great. April, I just saw you turned your camera back on. Do you have questions or thoughts about kind of what's happening in Montgomery County, PA on the ground as far as Delta goes?
No, I do not have any questions.
Well, so this is related, Emily. It's an Emily question. It's also a Mia question about diversion. April, it's about a partnering at the community level. I think we all have seen the importance of partnership is everything for using these funding streams, but also with public health and protecting people's healths and literally their lives for people experiencing homelessness. So April, Montgomery, PA has been so good at building these partnerships. Can you tell us, since we're talking about the pandemic now, what you guys have been doing as far as like with the public health infrastructure in the community, healthcare for the homeless there, if you guys have healthcare for the homeless, what's happening specifically related to people experiencing homelessness and COVID-19 specifically?
Well, that would be more on the crisis side. That is not something that I technically do. But I know that they work with the community members, have a building relationship, I would say, with the community. So they typically know who the individuals are who are experiencing homelessness on a regular basis, meaning like they're sleeping on the street, they enter the shelter all the time, they're in the shelter. They have a working relationship with those folks. And so I can't speak to that, but if whoever asked the question, you can most certainly email me and I'll get you that information.
Great, thanks.
If I could just add to that question too.
Sure.
I think one thing that would be helpful for us all to think about as we're thinking about diversion. So I mentioned earlier how ERA is just another tool that is in your toolkit now to help, connect folks to if they're eligible, if they're appropriate for that referral. However, thinking about COVID-19 and thinking about the public health responsibility that we do want to ensure that included in those diversion conversations and that housing plan is that plan to keep folks safe. So do they have access to vaccines? Do they have access to PPE? A lot of cities, states are reenacting or have, what am I trying to say? Like making it so folks have to wear masks again, having a mask mandate. So we want to ensure that folks have access to having a mask, to having hand sanitizer, the same things that we were thinking about last year, April. We want to ensure that we're continuing that. I think that, we found some comfort in this idea that, we can take off our masks and that vaccines were going to, allow us to be out in the public space again. But I think we do have to put that hat back on and remind ourselves that we are still actively in a pandemic and ensure that folks that are experiencing homelessness, which again, we are working with folks who happen to be the most vulnerable in our communities, that they have access to this information and to the resources that they need to keep safe.
Thanks, Mia.
I will say at our shelters and those sort of things, there are availability of masks and sanitizers and things of that nature. We do, the crisis response team does hand out health kits to individuals who are sleeping in tents on the ground and things of that nature. Those who physically are on the street, like I said, in tents that we hand out, do receive based upon need, not need, but access to the availability of these things, because there's not always an availability of it. Those options are here as well.
Thanks, everybody. Emily, another one for you, and I don't know, I get that there may not be clear guidance on this yet, but we've started to see, again, because, you know, we had the pandemic, we thought we were pulling out of it. People were doing a lot of non-congregate shelter, and some of the funding for that has gone away now, but seems like we probably need to go back to that. So can you talk a little bit about just kind of like what's in effect public health wise for these COCs where we're starting to see high transmissions really go back up among people experiencing homelessness? Any guidance that's in existence or coming out, or just thoughts about that? Especially if there's not the funding available to go back to doing massive non-congregate shelters, right? Or, hey, Congress, we could use some more funding for that.
Yeah, so sort of like I was talking about before, the recommendations do, they are essentially going to remain the same. So that includes those space considerations. So decompression, protective housing, and non-congregate protective housing for people who are older or who have underlying conditions. Quarantine and isolation spaces are all needed right now. So that remains the case in terms of, you know, scientifically and public health wise, what is needed in this moment.
Great, thank you. And you guys, I'm about to share in the chat. We also did, again, talking about partnerships here, talking about public health. We recently did another webinar in this series on services that are available from Health and Human Services, right? So a lot of folks that you serve are eligible for Medicaid, especially in expansion states. There are resources out there to pay for services, both for folks in PSH and homelessness services, but also, again, good diversion practice, right? Like when you're diverting folks, is it that they need health services? They may have access to some kind of housing resource, but man, they really need some healthcare resources. That's an important piece of the partnership puzzle, and let's not forget about that. Oh, thanks, Kay. Kay just dropped a bomb in the chat for everybody on the call. The COC NOFA is out. It is due November 16th. So look forward to a bunch of resources coming from the Alliance on navigating the NOFA in a coronavirus pandemic. Any other questions, comments, folks? Kay, Mia, April, Emily?
I just want to make a comment that I'm just so grateful for the work of everyone, you know, working in homeless services right now, and this ability to pivot and reinstate these protections is really incredible and hard. So thank you so much for that. And please do reach out if you have questions or any needs that we can help with.
Thank you. Oh, thank you for reminding me. I will go all the way to the end. Everybody, again, the recording and the slides will be available, and some folks put in a request for all the links that we shared. We'll make sure that you can have easy access to those. Lots of great information out there. You see contact information here. Feel free to reach out to us, share with us your ideas, your concerns, what you're working on. Let us know if you have really cool, innovative stuff that you're doing that, whoa, is even better than Montgomery County, PA. Not possible. We want to know about it. So if we don't have any more questions, thanks everybody. We'll give you back a few minutes of your day. Great webinar. And again, like Emily said, thanks to all of you in the field doing this amazing work during the most difficult time for the folks who need it the most. You are our inspiration. Thanks everybody.